Thank you, Madam Chair and Ranking Member. Secretary Kennedy, when you appeared before this committee in June 2025, the big ugly bill had not yet been enacted, but you claimed that your department would not be cutting Medicaid. You said, and I quote, "We're not cutting Medicaid. There are no cuts to Medicaid." Despite active plans underway to dramatically change the program and severely reduce federal funding to states, you have actually repeated that today. And I just want a yes or a no. Is it still your position that a $900 billion reduction in federal Medicaid funding to states is not a cut? Yes or no?
Need
So,
to turn
yes
your
or no?
microphone
Are you
on, sir.
saying, can you just tell me yes or no?
That would only be a cut in Washington, D.C., a 47% increase in spending. How is that a cut?
I just
How is
want
it
you to
even
say
a
yes
cut?
or no. That's all. So you're saying it's not a cut?
It's a 47% increase.
Okay,
Is not
next
a cut.
question. Did your department find $900 billion worth of fraud in Medicaid to justify?
Excuse me?
Did your department find $900 billion worth of fraud in Medicaid to justify these cuts that you're saying?
There's been no cuts.
Did you
there's no
find
cut to
$900 billion
Medicaid.
in fraud?
There is no cut to Medicaid.
Did you
Yeah,
find
there's a lot of
$900
Medicare
billion in
fraud.
fraud?
There were millions of people on Medicaid. There were 3.7 million people who were getting Medicaid in 2 states, or they were getting Medicaid and Obamacare at the same time. And there were 1 million illegal immigrants on Medicaid, so that's fraud. We're getting rid of those people.
But you're
We're
not
not
saying
cutting
you didn't use
Medicaid.
that to justify the cuts.
Medicaid
Okay.
is increasing.
Next question. Do you have any evidence to justify eliminating the funding for critical programs like CDC's Safe Motherhood Initiative? You talked about maternal mortality, which is a devastating problem in the United States.
We
Do
had
you have evidence to justify eliminating the funding for that critical program? Yes or no?
we had 27 maternal mortality programs. We consolidated them. We're doing more on maternal mortality.
I
and I
know.
can show you the data than any administration in history.
You don't have to show me the data. I'm the one that brought the issue to Congress.
Yeah, I'm happy to.
So you're saying you eliminated the program because you're merging programs?
We eliminated programs that were duplicative or redundant. We are laser focused. We're serving 59 million women.
Still too many women are dying, and definitely too many Black women are
We're dying
dying.
before I
And that
came
is
in.
not getting better.
Yeah, it is getting better.
No, it's not.
Look at our
The national average
Look
is
at our perinatal
for Black
pilot
women
program.
at 3 to 1. In Chicago, it's higher
Our
than that. It's
programs-
higher than that in a lot of places.
our programs are making it better.
Retaking my time, please. The American people are not falling for what you're saying. Your attacks on minority health, women's health, LGBTQ plus health, and basic preventative medicine through illegal funding freezes and mass firings will lead to decades of consequences for all Americans. We're already seeing hospital closures, a reduction in services and staffing cuts. For example, a 28-bed obstetrics unit in Elk Grove Village, which is not rural, earlier this year. Mr. Chairman, I'd like to enter, or Ms. Chairman, a Newsweek article about the closure into the record, as well as a report from Energy and Commerce's and Senate Finance that document dozens of similar stories throughout the country.
Without objection, so ordered.
Labor and delivery units and maternity care are some of the most vulnerable healthcare services to funding cuts, which means pregnant and postpartum women must drive further to seek care. Change providers when clinics and hospitals close and face longer wait times and more risks in the case of an emergency. Secretary, are you concerned by these closures, particularly in rural and low-income parts of the country, but not just in those parts of the country? Because my district is urban, suburban, and rural, and I've seen the effects.
We're putting more money into improving access in rural health care than any administration in history. Oh,
I don't know about that.
it's $50 billion.
And lastly,
Never been done before.
before my time closes, you talked about, food, and there's approximately 150,000 people in Illinois that may lose their food because of the SNAPs to cut. And you talk about eat real food, not medicine. Real food is expensive. And when all those SNAP cuts that have already happened and will continue to happen, it'll be really hard for people to stay healthy. I yield back.
Gentlelady's time's up, and I recognize Mr. Balderson for his 5 minutes of questions.
Thank you, Madam Chair, and thank you, Mr. Secretary, for being here today. My first question, Mr. Secretary, is the budget for 2027 proposal centers around promoting